So you may be wondering if you, as a young person, may be at risk of developing colon cancer, or you may have heard about the risk of colon cancer in younger individuals. Well, in this video today, I will talk to you about whether you are at risk of developing colon cancer, whether rectal bleeding is normal. If you wait till the very end of the video, I'll tell you exactly what to watch out for to prevent colon cancer. Let's begin. In this video today, I'll talk to you about whether you are at risk as a young person to develop colon cancer. And if you wait till the very end of the video, I will tell you exactly what to watch out for and how to make sure you don't develop colon cancer when you're young. Let's begin. So thank you guys for joining me today. My name is Dr. Samir Islam. I'm a board certified poop doctor. Yes, that is an actual job title. My passion is to give you tips and tricks to help out with your gut health. If you're new to this video series, I do a lot of videos about gut health, medical health, and sometimes some product reviews as well. So if you enjoy these videos, consider subscribing. At any point in time, check out my show notes down below about different things that I can talk about and about different links that I may speak about in this video today. So I would encourage you to like this page and also follow me on my social media platforms. But in today's video, I will talk to you about why young people are at risk of developing colon cancer, and most importantly, what you can do today to make sure you don't develop colon cancer and what to watch out for. So before I begin this particular topic, I'm actually going to talk to you about what are the stats for colon cancer. So we know that colon cancer is the second leading cause of cancer death in the United States, but the rates have been decreasing in older individuals. With the advent of colonoscopy pretty much universally across all insurance plans, the rate for developing colon cancer as we get older has decreased tremendously. We have made a lot of great strides in doing this. So colonoscopy has saved lives, but we have found that there are more and more younger people who are developing colon cancer, and we're trying to figure out exactly why. And so there have been some societies that suggest that we should actually start looking for colon cancer at the age of 45 years old as opposed to the traditional 50 years old. And in fact, the American Cancer Society did recommend starting screening at an earlier age. But what I want to talk to you about is actually a real case that happened to me not too long ago. So I actually had a 30-year-old, in their 30ish-year-old young female come see me for kind of intermittent rectal bleeding. She had some blood in the stool. She had some blood whenever she wiped. Didn't think anything much of it. No weight loss, no family history of any GI problems or GI cancers. Kind of had bleeding here and there, but nothing too big. She spoke to her primary care provider about this, and she assumed it was hemorrhoids. And she was also told by her provider that this may be hemorrhoids, especially given how young you are. But it may be important for you to at least see a GI doctor to get their opinion about whether this is hemorrhoids or not, what we can do about that. So she came to see me in the clinic, and I talked to her, and she had nothing really that was concerning in terms of her history, except for the fact that she had just this intermittent bleeding. It wasn't that bad, it wasn't that often, but kind of off and on for a few months. Like I mentioned before, no pain, no weight loss, no family history of colon cancer. So I told her the options. The options are we can just assume it's a hemorrhoid and just take care of it, or we can actually do very thorough investigation and to see exactly if it is anything else that we have to worry about. And given the risk and the benefits, she opted for the more thorough evaluation, which was doing what's called a colonoscopy, which is that very small camera which would take a look inside the colon to see exactly what's going on. So we went ahead and proceeded with the colonoscopy, and lo and behold, we found cancer. We actually found colon cancer inside this colon in somebody who is a young female, no family history, no warning signs, except for the fact that they're having intermittent bleeding, which is why we're really worried about the rise of colon cancer in younger individuals. So we know that more and more younger people are developing colon cancer, and we know that when you have colon cancer when you're younger, there is maybe a different profile for how that colon cancer is. And we also know that for our younger patients who have colon cancer, the rates of death is actually increasing, and we don't quite understand what's going on. We think, though, that it may be a couple different things, but what I want to stress that even though we do see the rise of colon cancer in younger individuals, that risk overall is very, very low. So the stats that I really give my patients who are young, who have colon cancer, is that the most likely cause is maybe a hemorrhoid, but the most concerning cause is colon cancer. And we do know that colon cancer when you're young, there is a difference between colon cancer when you're older as well. We know that when you're younger, it tends to be a lot more aggressive. Also, number two, there's a higher chance of developing what's called metastasis or spread of the colon cancer, going from stage 1, which is a localized cancer, to stage 4, which is a colon cancer that's spread pretty much all throughout the entire body. And so we don't understand why that's the case. We do know that there are different theories about what's going on. Maybe diet's playing a role. We know that diet plays a role in a lot of GI conditions and also in cancer as well. There could be something in the way that we're eating, maybe processed foods or smoked foods, that make you at high risk of developing colon cancer. We also know that colon cancer in younger individuals actually may be a different type of cancer. It may not be the cancer that we see as we get older. Maybe it's a more of aggressive cancer than what we typically see, or a completely different type of cancer. And so that we are doing more and more studies about how this is developing and what's going on. So here are my tips for what to watch out for. Number one is bleeding. Like my young patient who came to see me, rectal bleeding. Rectal bleeding is never a normal thing to have. If you have blood in your stool, don't assume that this is normal. It is not. Please make sure you speak to a healthcare provider about bleeding from your rectum, whether it's bleeding intermittently, blood when you wipe, blood that you see in your stool. Any type of bleeding from below is something that needs to be checked out. Now, like I mentioned before, the most common cause for rectal bleeding in a younger individual is hemorrhoids or a tear in the rectum or a fissure. But the most concerning thing is rectal cancer or colon cancer, so don't ignore bleeding no matter what you hear. Number two is weight loss. Now, our patient did not have weight loss, but this is something you have to watch out for as well. If you have unexplained weight loss that you cannot describe or understand why that's the case, make sure you speak to your healthcare provider about what could be going on. The third thing to watch out for is significant diarrhea. You should not be having a significant amount of diarrhea, especially coupled with weight loss and bleeding. If that's the case, make sure you speak to your healthcare provider about what could be going on. Next one is abdominal pain. You should not be having a lot of abdominal pain, especially pain that maybe wakes you up in the middle of the night. That's not typical for some of the more non-worrisome things. So that, with a combination of the other symptoms, could be a sign of something growing inside your colon. So what to do to make sure you don't have colon cancer, or if you're having these symptoms, what can you do to make sure that nothing else is going on? Number one, don't ignore your symptoms. This is probably the most important thing that you can do. Speak to your healthcare provider. Talk to them. Be honest about what's going on and let them know what's going on. Don't just assume that this is something that's normal. Number two, you may have to get a colonoscopy. And I understand that there is a lot of embarrassment with getting a colonoscopy. Maybe you're young, in your 30s, you're wondering, well, I don't need a colonoscopy. That's something my parents did. But the worst conversation I've always had with a patient is telling them that they have colon cancer when they could have prevented this by getting evaluation early. Trust me, it is a lot safer and a lot easier to drink the prep from the colonoscopy than to drink the prep from the chemotherapy. So don't ignore that. If you have to undergo the colonoscopy, speak to your GI doctor about how that is. It is a very easy procedure for the vast majority of our patients. Number three, establish healthy eating habits. We know that food does play a role and making cancers worse. So try to have a diet that's low in fat, low in smoked foods, because we know that fat, smoked foods, and sometimes even meats can put you at higher risk of developing colon cancer. If you have a family history of colon cancer, especially in your first-degree relative, mom, dad, brother, or sister, or you have multiple second-degree relatives, aunts, uncles, who may have colon cancer, even cousins, let your healthcare provider know. It is so hard for us to know the family history, especially if you don't tell us. So be forthcoming. Let us know about the family history of colon cancer. If you know somebody who has colon cancer and you just found out, let your healthcare provider know. Let your primary care provider know about that. Try to exercise daily. Even doing a little bit of exercise will make a tremendous impact in your risk for developing colon cancer. If you can prevent colon cancer, one thing you can do is try to exercise daily. The last two things, avoid excessive alcohol, avoid excessive smoking, avoid smoking actually at all costs. These two things does put you at high risk of developing a lot of different cancers, including colon cancer, including other cancers going on inside the GI tract. So try to avoid excessive alcohol and excessive smoking as well. This will prevent your risk from developing colon cancer. If you can do these things, and if you can make sure you process these things, I can tell you, you are going to make strides to prevent you from developing colon cancer, and you're going to prevent this unfortunate incident from happening to you. So let's go back to my case. So we did have this young lady who had intermittent bleeding who ended up having colon cancer. Luckily, this cancer was localized to the colon. It was what's called stage 1. So we sent her immediately to get a CAT scan. There was no spread of the colon cancer. We sent her to surgery. They removed that part of the colon out. She saw me a couple months later. She's doing fantastic. She has no recurrence of her symptoms. She feels great. Her colon cancer is resolved. She recovered well from her surgery, and she was able to move on with her life. Now, I did tell her that her children need to be aggressively evaluated for colon cancer as well, and she's undergoing that evaluation for her kids. So she actually had a very happy ending to her story. So in summary, there is a rise of colon cancer in younger individuals. Make sure you get make sure we don't quite understand why this is the case, but we're trying to find out exactly what's going on. Number two is that no one really knows why, but we know that there may be a different cancer that's being developed. We know that cancer in younger individuals tend to be a little bit more aggressive and tend to spread a little bit easier as well. Don't ignore the symptoms. If you have symptoms of bleeding, even if you think it's a hemorrhoid, don't ignore that. Don't forget that. That is something that needs to be evaluated. Live a healthy lifestyle. Make sure you have a healthy lifestyle. Minimize smoked foods, fatty foods, stop smoking, and minimizing alcohol. Make sure you exercise daily. These are healthy habits to prevent colon cancer. So if you are wondering if you should get a colonoscopy, click on the show notes down below. I will give you a link about what we do, about how to actually get your colonoscopy. You can get your colonoscopy done by me without having to see me in the office. I have a link down below for our policy on colonoscopy. If you want to call us instead, this is the office, this is the number that we have, and tell them you are interested in getting a colonoscopy by Dr. Islam. We may have you answer a couple of questions about whether you are a candidate to get your colonoscopy done. If you are worried, make sure you see a healthcare provider. Well, thank you guys. So my question of the day for you guys is, what will you do today to prevent colon cancer? Will you schedule your colonoscopy? Will you speak to your healthcare provider? Will you speak to somebody about this? Will you actually find out about your family history? Comment down below. I would love to hear what you're going to do today to prevent colon cancer. I want to thank you guys for joining me today. Typically, I do my Facebook Live every Tuesday at 7:30 p.m. and every Thursday at 7:30 a.m. I do what's called my Poop Tip Thursday, where I try to give one poop bomb for the week to help out with your gut issues. If you like these videos, I would encourage you to follow me on social media, whether it's my Facebook page, Instagram, or my YouTube page, why I always repost these videos on these social media streams. Thank you guys for joining me today. Hope you guys have a great day. Look forward to seeing you guys in future videos. Thanks and take care. Thank you guys for watching my video today. If you are interested in scheduling a colonoscopy, I'll have a link right here about how you can schedule your colonoscopy. And for more videos about how to prevent colon cancer, click here down below. Thanks and take care.